So when is it time to have a facelift? We get this question a lot, and I have to say it's very personal. I had a patient here this morning. You can tell she wants desperately to have a neck lift, and she wants her eyes to be cleaned up as well. But she's just so nervous. I tried to explore that and say, what are you so fearful of? What is it that is stopping you? She wasn't crystal clear, but we came up with a couple of things that are bothering her. It makes sense to me because I've heard these things before. A lot of folks are afraid they might look weird when this procedure's over. And I understand because I know we all can point out one or two celebrities who got pulled too tight or for whatever reason they just look weird. It's not good for me if you look strange. Therefore, we use a lot of techniques these days to try to make sure that your hairline isn't changed and you're not pulled too tight. Personally, I like to use the extended deep plane facelift because I think it is the most natural way to restore someone to a place where they were several years ago. Along those lines, while we're in the OR, a lot of patients are concerned with anesthesia, and they have this whole idea that anesthesia is bad. Well, I can tell you that the technique we use here is with sedation, where you are breathing on your own. The machine is not breathing for you. That doesn't mean they're under twilight. They don't know anything that's going on. As far as they're concerned, there was an IV started and nothing has happened until suddenly they wake up and they don't realize that several hours have gone by. Finally, I would say that some folks are concerned about having scars and whatnot, and they don't want to have telltale signs. Well, with the way that we're designing these operations today, we put these incisions in places that are very hard to spot. We try to keep the incisions inside the ear, in the hairline, behind the ear, like tucked in behind in the corner of your ear, in the area where your mom always told you to make sure you wash well, that kind of thing. And so I'm not as concerned about that either. I think that if we have a chance to talk about these things, and if patients truly understand what the plan is, they may not be quite as fearful. So we'll keep you posted and we'll let you know if this woman I saw today ever books her facelift.